We want to expand the Smile Bright program to provide more sealants for the children to protect them against this dental disease, which is really prevalent. We are already engaging additional dentists who have volunteered. They've come out to the plate to say, I will volunteer my time to do screenings, to provide services in their offices, or to provide pro bono work at the Children's Dental Health Clinic. What we want to do is to educate not only our school children, but our parents and our community members on the very important issue of this disease, and also that oral health is relevant to each and every one of us in our community. So we want to advocate oral health. We also want to increase the resources to expand these services, of course, because we've got a big task before us. So our outcomes will be healthier children. There'll be less number of school days that will be missed. In fact, one of our objectives is to make sure that we educate our parents so that the parents don't take the kids out of school because they're going to go to the dentist. To make sure that if they have an early morning appointment, that they go back to school, assuming that the kids are not sedated, but to go back to school, because we want to work hand in hand with our school district. This is the only way it's going to work. And we don't want the school district to miss any days of the ADA days. And this is doable. The children can have a dental appointment and still go to school. So we've got to make those provisions for our school children. This will be cost savings for all concerned. It'll save money from the Denti-Cal program, from Healthy Families program, and actually invest those monies into prevention. In pediatrics and in many other health issues, prevention is key. Then we should have civic pride that we are taking care of our children, and that those numbers that you saw earlier on that slide, 3/4 of our third graders and over half of our kindergartners that have had tooth decay at a very, very young age, that we can minimize that. We've got very specific goals about that. And as a community, my hope is that we can be very proud of this initiative. There'll be other counties, there'll be other cities that will be doing the same thing. I think that California, all in all, is moving towards that. But we certainly want to be a model in California. So what are we asking the board to do? We're asking you to support an oral health education, to emphasize oral health in our curriculum, and to support us in our dental screenings in this initiative. To promote the concept of dental home, that just like the medical home, that's a place where a family or a patient can go to obtain either information or dental services, or if they have emergency care to be had, that they have a home, they have a dental home. And it could be the Children's Dental Health Clinic, it could be a private office. We also want to collaborate with you on this oral health assessment bill that just passed, AB 1433. Because we've got to have 6,000 kindergartners screened, assessed, or examined in the next year and a half. And we can do it. We also would like to have access to your translation team. Long Beach, as you know, it's ethnically diverse. We're all proud of that. This is an asset. And we want to be able to communicate with all members of our community. So if you have the translation team, we certainly would like to translate some of those oral health messages to our community members. And as I said earlier, if we can incorporate oral health education, and I'm sure it's already been incorporated, but in a very proactive way, I think that it'll pay us dividends down the line. I'd be happy to answer any questions. I hope I didn't take too much of your scheduled time. I appreciate being on the agenda tonight. Any questions from the board or anyone else?
Dr. Cortez, if I may, this new AB 1433 Does that mandate sometime during the school year of a kindergarten student, he or she must have an assessment?
The assessment can be done either 12 months, it will qualify. So if a child came to my office, had a dental examination today, all the parent would need to do is to present the very simple assessment form. I would sign off, and the parent would then present it to the school to be provided into the Office of Education, and I assume this is LA County office.
That needs to be done during the first school year.
Either 12 months before the child starts.
Or before.
Or until May of the following year. So they essentially have a good year and a half to comply with that.
Dr. Cortez, I just want to thank you for the work that you're doing. I'm very supportive of what you're doing. I know that some of the information that you pointed out is very, very relevant to our schools, especially in terms of children being in pain in classroom, something that I think you touched on, but it's very difficult to learn when you are in pain. And that child may in fact be at school that day, but if they're, if they got a bad toothache or if their teeth are rotting out of their head, like some of these kids obviously are, then they're not going to be very effective students. If you wouldn't mind backing up one screen, I'd appreciate it. I'd like to, Mr. President, I'd like to move that the board direct staff to prepare a report on the efficacy of supporting the Oral Health Task Force on these 6 items that you see on the screen right now.
Very good. It's not an agenda item.
Right. To get some information,
So
we'll bring
It would be a report.
Yeah, we can put it on the agenda for next meeting. I think in spirit, though, that we're all in concert with you, Dr. Cortez. There's not anyone here in this room tonight that doesn't support the work that you do.
Thank you.
And what we need to do for our kids. Gee whiz, wouldn't each of us like to go into every home of a newborn and say, it's important that you put this youngster on your lap and read to it and keep its teeth clean. Crying out loud.
Absolutely.
Wish it were that easy.
That's a good message.
Mr. President, if I may, I want to commend Dr. Cortez too. He does an outstanding job, and this is a great opportunity for Long Beach to be the shining star again in our state, because we have all the resources, as Dr. Cortez said. So we'll be working with him and others on treating this oral health assessment, much like we do our CHDP right now. But I am going to send all of you an invitation to visit the Smile Bright program. As Dr. Cortez says, it's a wonderful program, but at the same time, when you see some of what our students are suffering from, it's very disheartening at the same time, so you know why we have to advance this agenda very quickly. Because I saw a young man in the 3rd grade that had a huge abscess on one of his teeth that had to have emergency treatment, and it was because of this program that we were able to identify. And that student was in great pain, but didn't tell anybody, and was plugging away every single day. So I want to commend Dr. Cortez and everybody out there. They do a beautiful job at the dental clinic.
And Patty Acosta also does tireless work for you. Best to her as well. Thank you so much.
Excuse me, in one of my other lives, I was a dental clinic volunteer and the 2nd grade teacher, where you went around and taught how to brush your teeth. But one of the things we have in our city is a cultural bias. Some parents feel that the baby teeth are going to fall out, and therefore we don't need to do anything with them. So it's an education thing that we have in front of us.
That's correct. And that's actually our number 1 goal, is to educate our families, educate our children in the school district. The more education we have about this issue, the better everyone will be, especially our children.
Right.
Thank you.
Thank you very much, Dr. Cortez.